Welcome everyone to the first Cure SMA Summit of Strength virtual webinar series. This is Colleen McCarthy-O'Toole from Cure SMA, and we're all so happy to have you with us today. We'd like to thank our sponsors, AveXis, Biogen, and Genentech Roche for their support. We're so excited to receive so many questions in advance of today's webinar, and we're going to try to answer many of these during the presentations today. You can also submit questions during the webinar using the chat box in the bottom right side of the screen. All of the phone lines are going to remain muted during the call other than the speakers. If you have any additional questions after today's presentations, please contact Cure SMA, the family support team at familysupport@curesma.org. And we're so happy to introduce our first speaker, Dr. Al Freedman, who will be presenting on supporting the emotional health of our SMA-affected families during uncertain times.
Thank you. Good morning, good afternoon, wherever you are. Thank you very much for the introduction, Colleen. My name is Al Freedman. I'm coming to you live from picturesque Westchester, Pennsylvania, just outside of Philadelphia. It's a beautiful day here, and I hope it is wherever you are. I want to begin by thanking everyone at Cure SMA, our leadership, Kenneth, and Dr. Schroth, and Colleen, and especially Colleen's family support team today, who are working hard behind the scenes to help put all this together. As you know, when we come to conferences, we can see all the folks at Cure SMA buzzing around to make our conference experience enjoyable, and going virtually is just as much work in a different way. And I appreciate their support in helping me get set up for today's webinar. I am a practicing psychologist, and my practice is focused on work with children, adolescents, and families, especially families with special needs. Because there's been so much uncertainty in the world over the past few weeks, this has been a very busy time to be a mental health professional. Everybody is really stressed these days. So I've been asked to help with a number of online support programs over the past few weeks. But I'm very honored to be helping to lead off this new series of Summit of Strength webinars today for the SMA community. I've been looking forward to today's session because I myself am a member of this community together with all of you. Next slide, please, Michelle. Thank you. My experience as a psychologist is certainly helpful. It's the work I do every day as I prepared for this session and share my thoughts with you about how we can manage our emotional health during these uncertain times. But my experience as a dad and working with our SMA community was probably even more helpful in many respects. For those of you who don't know me, I'm pictured there on the left with my son, Jack. Jack was diagnosed with SMA at the age of 6 months in 1995, and he's now 25 years old. And if Jack took a break from what he usually does right now with his Facebook and his computer games and his part-time job, he might actually be listening to Dad right now. There's a shout out, Jack, if you're on. And on the right-hand side, among the many workshops I've facilitated over the past 20 years for Cure SMA, one of the most special opportunities I have as a counseling professional is our Talk It Out groups with our kids, our younger kids, our older kids, and now our young adults as well. The photograph that you see there was taken last summer at our most recent conference in Anaheim. I've learned so much from so many of our children and from my co-facilitator, Angela Rigglesworth, who's in the back right-hand corner, a very gifted teacher and member of our community. These experiences, both personal and professional, have informed my work with our community, and I hope that my perspective is helpful to all of us out there today. Next slide, please. What I plan to discuss today are a number of things. First, why change, especially this type of abrupt change, is so stressful to all of us. Second, why I believe our community is very well prepared, actually, to handle this stress. Third, I'd like to encourage us to focus on what we can control during this period of uncertainty. Fourth, a couple of pointers and strategies for families who are working through this situation and all the uncertainty that comes with it. And finally, I believe that our community can be a model for others right now, ironically. And I'd like to talk a little bit about why I feel that way and how I believe we are already models for others. Next slide, please. Why is this pandemic situation so stressful for us? This is an abrupt change, and abrupt change triggers very uncomfortable feelings for everybody. Because this virus is so contagious and it can cause serious health problems, our sense of safety understandably feels very threatened. It's very common to have a wide range of very strong feelings in reaction to this very unusual disruption in our lives. Many of my clients have experienced and have articulated to me a wide range of very strong feelings, including first, feelings of disbelief or denial. This isn't real. This can't be happening. Second, feelings of anxiety. I'm really scared, Dr. Al. I've heard many times in the past few weeks, and anxiety is a natural feeling we all have under these conditions. Another feeling we can have is a feeling of more control. When we start to respond to the situation and get things done and take charge in the ways that we can, we start to feel more in control. And finally, we are sometimes able to look past the immediate crisis into the future and tell ourselves that this problem will not last forever. This is a temporary problem, and we will eventually get back to normal. And that's a more peaceful feeling when we have that feeling. So I'd like you to think of these different types of feeling states or emotions, not as steps that we all go through in a specific order or a specific sequence, but as we adjust to this abrupt change, our feeling states are more like rooms in our house. We move between these feelings, like we move between rooms in our house in no particular order. An important point I'd like to make today is that we do have the power to influence how much time we spend with each of these feeling states, just as we have the power to move in and out of rooms in our house. Next slide, please. So on one hand, our SMA community may be feeling extremely vulnerable right now, and it makes sense that many of us feel that way, given our physical vulnerability. But on the other hand, I do want to emphasize that I believe our community is in a very strong position to understand and manage the feelings that are coming from this crisis, because we have a whole lot of experience with unexpected change and surprises. Every one of us remember the day that our lives were turned upside down when we received a diagnosis of SMA. We have practice at living with uncertainty. So many of us affected by SMA have lived with uncertainty about our futures for months and years prior to this pandemic. And we also have experience with isolation. Many in our community are very medically fragile and always have needed to be careful of our exposure to other people's illnesses. This is something I personally have needed to do with my son for many years. And many of our families have never been able to do all the things that others can do. So we've had experience being socially limited as well. So I believe that in the face of such challenge, we are, as a community, very uniquely prepared. Next slide, please. So I think it may be helpful to remind ourselves that as a community, we have a whole lot of preparation for this crisis because we've all learned how to adapt to the unexpected. We are all very resourceful and creative. We always had to be. We are resilient. And I know from the many years I spent in those conference rooms with our kids, how resilient our SMA-affected kids and adults are as people. And we are hopeful. We've always been hopeful. We are experts at facing challenges and adversity. So I believe these qualities are serving us well and will continue to serve us well as we're moving through this very difficult period. Next slide, please. Having lots of practice with managing the unexpected certainly does help, but the anxiety that we feel is real and it's understandable, especially to those of us who are already medically fragile, as my son is. the situation we face is frightening. So these feelings of vulnerability that we all have need to be respected. There are things about this pandemic that don't feel within our control. And in some ways, you may be reminded as this pandemic unfolded of the situation, the feelings you felt when you had an initial SMA diagnosis. It didn't feel in control to me. And it makes sense that we all feel this way and might have those feelings triggered again. But we can do something about the clarity of our minds, our mood, our sleep, our perceptions, and our thoughts, which are all related to our emotional health and our mental health. This is really important because what this means is that we are not powerless in a situation. There are things about the situation that are in our control. So I'd like to focus for a bit on what is in our control, because when we focus on what is in our control, we feel safer and less anxious. Next slide, please. Here are a few things that are in our control. First, how we take care of ourselves. I would tell you as a practitioner that when I'm presented with complicated problems and people's emotional stress, that oftentimes the problem is solved by paying attention to three basic things: how much sleep a person's getting, how much and the type and amount of nutrition we're getting, and exercise. It's important that we get enough sleep and not too much, enough food but not too much, and exercise, however, whatever that means for you and for us in the SMA community. We have control over these things. We have control over allowing sunlight and fresh air into our living spaces, and we have the control to choose to spend time outside. If you can get outdoors, it will make a big difference. I just took a walk before this presentation in the beautiful sun out in my town, and it just feels so good to get outside, to get fresh air, and to exercise as much as possible, whatever that means for you. For me, it's walking and running and doing other working out. For my boy Jack, if you're listening, we got him in his power chair, and he needs to exercise those muscles to be in both of his wheelchairs and to be driving his chair to maintain the physical health that he does have. Finally, intentional relaxation, like meditation, breathing exercises, and thinking exercises based on a method that we call in psychology cognitive behavioral therapy, thinking positive thoughts. We all need to do the best we can to stay positive and to allow ourselves to rest and relax as much as possible. These are things that are in our control. Next slide, please. How we make choices about the use of our time is also in our control. This virus obviously is very, very contagious, and so is fear. Fear can be contagious. So what I believe is we need to all use what I'm calling fear distancing strategies to help ourselves and our mental health. First, it will help to create and maintain routines. Keeping to familiar routines will help us feel more comfortable and more in control. Our routines might need to be different now than they were before this virus unfolded, but if we can stay fairly consistent with how we plan and how we manage our days, it will help. Our SMA families are often creatures of habit and routine for all kinds of reasons, so we do have practice with this too. I would encourage us all to stay in familiar routines as much as possible. Second, a fear distancing strategy, especially here, is to limit our exposure to the news. I think it's fine to get the information we need to know to keep ourselves and others around us safe. But it's an information that we need to know to stay safe is very helpful. But if we expose ourselves to too much news right now, it's likely to trigger more fear and anxiety, which is not helpful. I would recommend keeping news intake to a minimum, and I'd recommend avoiding news at night before bedtime because it could disrupt sleep. I think also it'll help to focus on things other than the pandemic so that we can all take breaks from thinking about it. Enjoy some movies, TV shows, read a good book, play board games, enjoy time with your family, doing anything that's entertaining and fun and gives you a break from our worldwide concerns. We all need to take breaks from what's happening in the world. All of this, how we use our time, is in our control. Next slide, please. How we stay connected to other people through this situation is in our control. I'm not very fond of the phrase social distancing because I believe to be safe and to be healthy, what we really need to do is to combine physical distancing with lots of social connectedness, extra social connectedness. It's important right now to stay in contact with close friends and families, and this is also, I've been finding, a great time to reconnect with old friends you may not have had contact with for a while. Using video technology helps people to feel more socially connected. You may discover, and you may already have discovered, as I have in these past few weeks, how easy it is to connect with other people using a video chat technology that you haven't used before. My own entire counseling and consulting practice has gone online. I've not been in my office since this began to protect my son and myself from this illness. And telehealth for my clients and the video conference chats for support groups that I facilitate are working remarkably well. So I'd encourage all of us to use video technology very intentionally. And finally, to make plans to have this social contact. We all, before the pandemic, would say, hey, let's get together on Friday night at 7:30 and let's go out and have a beer and let's meet up and go to a movie. We plan those things. It's harder to do that right now. Things are very fluid. But what I'm finding, and many of my clients are finding, is that making specific dates and times to have this online social contact is what makes it happen. And that's what we're doing right now. We had a appointment here for this webinar, and here we are because we knew it was happening at this time. So how we stay connected to other people is another thing that we have in our control. Next slide, please. How we make plans, as I just said, and prepare also is in our control. And especially for us, our community affected by SMA, it's very important that we have healthcare plans that we feel comfortable with. It's important that we follow all the usual protocols and the treatment plans and the treatments that you and your family members normally follow and receive given your individual medical situation. I think it's been really important for me and Jack and Jack's nurses to know that we have all the medical supplies and the medications that we need on hand, to inventory those and make sure that you have backup and know how to get extra supplies. I've hunted down some extra supplies just in case our company is not able to provide what they normally do each month for Jack and his equipment. I think it's important also to reach out to your providers to know how to reach them should you need to. Many of our medical providers in the SMA world are now available through telehealth, as I am in my practice. And that's, I would say, for many of us, an unanticipated positive consequence of this situation. We now have access to many of our healthcare providers without needing to take our kids and our wheelchairs and our vans into a hospital setting for a whole day. Finally, I think it's really important for those of us who require caregivers in our homes that we put precautions in place to reduce the risk to you and to our caregivers. You'll feel more in control if you're clear about what you expect of your caregivers, and they'll feel more in control if they feel protected too. In Jack's situation, we are having nurses 24/7. We can't be without them at this point, and they're doing a wonderful job of helping to protect us and Jack. Masks and gloves and shoe covers and disinfecting zone before they get to Jack and clean clothes are all part of a protocol that we're using. And I would encourage you, if you need to use help in the home, to be very clear. And your caregivers will appreciate the clarity as well, because they want to be protected too. So all of these strategies of planning and preparation are also in our control. Next slide, please. Shifting gears now, and the next couple of points I want to make are meant mostly for parents. Being a parent's a complicated job. Don't we all know that, who are parents? With SMA and without SMA, being a parent is a hard job. Our kids are like sponges, and they're absorbing how we as parents are handling this very complicated period of uncertainty and loss of control. Our kids are always watching us. And right now, everybody is home. So our kids now have a front row seat into who we are as we interact with others during the daytime and the evening, at work and away from work. Many parents now no longer have that end of the day buffer of a commute from work to transition from work to home. In many of the families I work with, parents are needing to adapt to being teachers at home because kids are out of school, don't have the commute break to buffer before they get home. And our kids are watching us as all this is unfolding. They're watching us as parents try to adapt to changing conditions. They're watching us to see how we handle the stress. And what I'm hearing from kids during my counseling sessions is that the little things matter a whole lot. That as parents, when kids experience their parents being patient and kind and problem solving and being flexible and being generous, kids are appreciative and they notice their parents' efforts. They're watching us. Next slide, please. Our lives are always busy, and they're a different kind of busy right now. And it's often been a challenge for families with and without SMA to take the time to simply sit down and talk about how things are going. Many families are able to connect during meal times. Because of the unique lives that many of us live with SMA, it's not always easy to do this. So during this uncertain time, kids are wondering about a lot of things. When will I be able to go back to school? When will I be able to see my friends? When will things get back to normal? When will it be safe for me to go in the summertime to the beach? Will I be able to go to the camp that I usually go to? By taking a break from the day-to-day busyness and the new version of day-to-day busyness, we parents can learn a lot about what's on our kids' minds. And when we take that break and take time to talk together as a family, the first and most important thing we can do is simply listen. That's what I do in my work. It's the most important thing I can do. This is very unnatural for me to be doing all the talking right now, because typically when I'm working, I'm doing very little talking and doing a lot of listening. And when we listen, we learn a lot about what our kids are feeling and thinking. And the questions that our kids ask will help us to guide those family conversations that we're having. It's important that when we're talking about the situation with our kids, that we're both honest and reassuring. Kids need reassurance, but they also need honesty about what's really happening in the world, pandemic or not. I've noticed in my work that sometimes children, especially younger children, but sometimes adolescents too, have misunderstandings or misinformation about things that are happening. And sometimes their anxiety spikes up because they've heard something from another child or have misinterpreted something they've heard. So by listening to what's on your kids' minds, you may discover that they have some things on their minds that you can help them by reassuring them about and by correcting any misinformation they might have picked up along the way. And finally, as you talk with your kids, I would encourage you to insulate your child from your own anxiety. We all, adults and kids, are anxious in this situation, but it won't be helpful to your children if they pick up the anxiety that you feel. Do the best you can to take your anxiety to other adults or professionals if you need to, and try to be as reassuring and solid in the presence of your kids as you can. They'll feel more secure and more confident if they sense that the adults in their lives are feeling solid and secure themselves. This is easier said than done in this situation, but very important. Next slide, please. I want to going to finish soon, and I want to finish by pointing out that our community, I believe, is already helping others and always does by being examples. We know that this virus is very contagious, but I've learned from my experience over all these years, 25 years with my son and working dozens of workshops and conference presentations over the years and work with our SMA community. There are a lot of other things in life that also can be contagious. A positive attitude is very contagious. Resilience, which our kids have and our community has, can be contagious. Having hope is very, very contagious. And having gratitude, being grateful for every single day, is contagious. So I know from my years being part of this community and supporting so many others through my work and having others support me, that our SMA community is not only prepared to face this challenge, but to be an example for others. That's what we've always done as we've adapted to the challenges that come with SMA. We have all learned how to move ourselves from a place of fear to a place of gratitude and love. We can show others what it means to face adversity with grace and with dignity. That's what our SMA families, we've all done, always, every single day, for a very long time. Next slide, please. I'm going to finish with this slide. Then we'll open it up for questions. I was walking down the street yesterday here in picturesque Westchester, PA, thinking about what's the most important message that I wanted to share with all of you in this community that means so much to me today. I was looking for a bottom line, most important message, walking down the street about 3 blocks from here and past this house. And a lot of houses and businesses have little hearts in the window, but this house stopped me in my tracks. We are all in this together. And I love the sentiment that the family who lives in this house have displayed for all of us here in our town. When we get a diagnosis of SMA, we feel by ourselves, but we are not alone. We have the support and always have of Cure SMA. We have the support of each other, and we are going to make it through this with each other's support. We are all in this together. Thank you all for your attention. It's odd to be doing a presentation like this without seeing the faces of the people that I usually have the privilege of seeing. I hope my comments and my perspective have been supportive and helpful. And we are all in this together, and I'm here to be of support to our families any way that I can. Thanks for listening. I'd like to move on to any questions that I can help answer that have come in.
Yeah, thank you, Dr. Freedman, for those incredibly useful tips and the thoughts and sort of walking through that so calmly, and we really appreciate that. We did receive several questions submitted in advance of this call, and we'd love to talk through those. We can go to the first question. These questions did come from a mix of adults with SMA as well as families and parents. So the first question that came in, we actually saw a couple of times, was how can I stay busy and unstressed when I'm at home all day, every day?
It's a great question, and it's a challenge for many people right now, within and outside the SMA community. My very simple recommendation for this question is to make a plan for each day before the day starts, and either the night before or in the morning, to think about how you want to use your time today, what you want to accomplish today, what obligations do you have today, what routines do you need to follow today as part of your treatment if you have SMA, and actually jot them down. I would encourage you to include some outside time, some relaxation time, some social time, meal time, whatever that means for you as well. And if we all make plans, as we do when we're under normal circumstances, it's going to help us to move our days along to feel busy and feel like we're being productive. And we'll be less stressed if we have a plan and know what we plan to do today instead of wondering, what should I do all day? So it's a simple recommendation, but it works for me and it works for a lot of other people. Try a simple plan for each day before it starts. I hope that helps.
Great, thank you. The next question we had is about, what do you recommend on how to support people with SMA with valuable information that won't create more panic?
It's a great question. I'd like to recommend that all of us in the SMA community use the valuable information that's been posted on the Cure SMA website. Dr. Schroth and her team have worked hard to collect information that's important and relevant to our SMA community. And it's all in one place, I think, in a very helpful place. I think, as I said before, that it's important for us to keep a balance between exposing ourselves to information that might cause anxiety and taking a break from exposure to the information that'll cause anxiety. And as I said before in the presentation, I think it's important for us to know as much as we need to know in order to stay safe and to keep others safe. But we don't need to saturate ourselves with news and information beyond what we need to know to stay safe, because that will create more anxiety for ourselves. Try to limit the information intake, whether it's news, as I mentioned before, or just reading information online in other sources. Try to limit the amount of time you spend, and allot time as part of that plan I just mentioned for your day, so that you keep it to a minimum and you keep it balanced with other things that are more relaxing and fun for you.
Great. The next question that came in clearly came from a parent, but I think this is probably something a lot of adults are feeling as well. So as nurses and other healthcare professionals are coming into the home and there's anxiety about bringing the virus into the home, how can folks manage their fears about this?
Thank you. It's a great question and close to my heart. As I mentioned, we have 24/7 care for Jack that we really can't be without. My anxiety about this was very high in the beginning, and it's lower right now. And the way that I've managed my own fears about this has been, as I mentioned before, to have a very clear protocol about how outsiders come into the home, to know that caregivers are not exposing themselves unnecessarily to risky situations. The nursing agencies have protocol to do temperature checks and other medical checks and questionnaires to make sure that there's a minimal risk, and to have a plan with your caregivers about how they're going to protect themselves and your family from the virus when they come into the home. Protective equipment and different higher standards of protection are necessary now. And when we take those precautions, it helps to reduce our fears. We can't eliminate this risk with this virus, and we can't eliminate the risk for our family members under all conditions. Without this pandemic, it's the same. It's just a more heightened state right now. So if we take a more heightened approach, we'll feel less anxious.
The next question we have is about a parent of a teenager. This is, my teenager has been acting irritable and angry because of all the changes and the obvious canceling of events. What are some tips to help me navigate with this irritable teenager?
This sounds like a fairly normal teenager to me. Teenagers are irritable sometimes, and they have reason, as we all do, to be frustrated and upset at all the things that are being canceled. It's understandable that this teenager is frustrated, and working with lots who are. The simplest and most important tips I can offer here are to, again, listen, to let your teenager vent, and to be patient and kind and compassionate in response to what you hear. Sometimes teenagers can cause us frustration as parents and don't give us a whole lot of latitude because of how they present themselves when they're frustrated. This is a time to give extra kindness and compassion and love to our kids who are feeling the losses they're feeling right now. I hope that helps.
The next question, you spoke a bit about in your presentation, but maybe a little bit, giving a little bit more advice. This person writes, I am very anxious about the virus. How much of my own anxieties should I share with my children?
As I mentioned earlier, I do the best you can to insulate your own anxieties from your children. We all have anxiety about this situation, and we all need to talk about it, and we all should talk about it. I would encourage everybody to be supported with our own anxieties by talking to friends and family and spouses and professionals if the anxiety is really disrupting your day-to-day. But I would do the best you can to get that support away from your children so that when you're with your children, you can present yourself as sturdy as you possibly can to help them feel as sturdy as they can.
Great. The next question says, to what extent should caution for your affected child be? We have two parents not on the same page as to how concerned we should be about the virus. How can families be best to work together?
We could do a whole nother session on this one. It's a great question. In my work with families with and without SMA, no two parents are always on the same page about everything related to their kids. And with this particular situation, it's understandable that two parents would be in different places about how concerned to be and how to respond. I'm not I'm not a physician, so I wouldn't get in the middle of this one, but I would encourage this family and any families who have concerns about the virus to consult the medical professional that you trust the most, who knows your child the most, to give their recommendations about what's appropriate in response to the virus. An objective medical professional will be able to help support parents who can't be fully objective. None of us can be about our own kids. I hope that helps, and there's a whole lot more to say about this, but we don't have the time to do that whole session right now. I hope that helps to start.
Great. And our last question is about children and being anxious. If my child seems anxious and depressed because of everything going on, how do I know what's normal and when to be concerned? And when should I seek help, and essentially how to seek that counseling help when you need to stay at home?
Well, thank you. This is a very common question for Dr. Al to receive. We parents know our kids better than anybody. And the way to know when to be concerned is when you see significant changes in your child's affect or behavior that cause disruption to their day-to-day functioning. Now, obviously, this pandemic is a reason for concern and a reason that kids will have different affect and behavior. But as parents, your instincts are always on the money. And if you feel that there are significant changes that are disruptive to day-to-day functioning, getting in the way, especially of eating and sleeping, or you hear concerning language coming from your kids or any kind of unsafe behaviors, or disruptive emotions that are interrupting day-to-day functioning, that's when professional help is appropriate. And right now, as I mentioned before, counseling professionals are all, most are working online and doing professional counseling through video chat, and it's very effective. So you can get counseling when you are at home, and psychologists and other mental health professionals are available to help answer that question. Is this normal? And does my child need more help? I receive that kind of question all the time, and I'd be happy to help anybody in the community with that question at any time. I hope that helps. You had mentioned that's the last question. I want to just say thanks again to everybody for your participation, and I hope that my perspective today is helpful, and what an honor and a privilege it is to be of support to the Cure SMA community today, as it's been such a support to me and to my family as well. Thank you so much.
Thank you so much, Dr. Freedman, for such a great, helpful, and informative presentation. We would now like to welcome our next speaker, Jennifer Miller-Smith, who is representing AveXis. She will be sharing her presentation, Adapting SMA Life During the Time of COVID-19.
Thank you so much. And I would like to echo Dr. Al Freedman in saying that how great this presentation and this time for, changing everything with the Summit of Strength from Cure SMA, all their resources and having this session is so valuable to our community. And we're thanking everyone for all the behind the scenes work. I'd like to disclose that I've been a consultant for AveXis and also an ambassador for Biogen. And I am speaking about my experience and our family's experience, but my experience in the role of a caregiver's perspective of the mother of my daughter, Madison, who is 13 years old, and she has type 2. So next slide, please. That's Madison. A little bit about Madison is that, she's in 7th grade and she loves, boating and softball and fishing and all the things a typical teenager likes. So before COVID, she had a very active life. She was, in school full time and had all advanced classes, so that came with a lot of homework. But she was always enjoying her face-to-face time with her friends at school. And then 4 days a week, she plays on a travel softball team, so she had a lot of face-to-face interaction. So I like to call it, BC, before COVID. What our family, we were very, very active all the time. Next slide, please. And so what we expected, with our busy life is also what came with SMA is always protecting Madison of germs. So on a daily basis, we already in place every 10 feet in our house, we have sanitizer. We sanitized our house daily with the Lysol wipes. We have bottles and jugs of sanitizer every 10 feet in our house, in both of our car doors on each side, and Lysol wipes in our car. That's our normal routine, just to always prevent, of Madison getting any germs, because it affects her, a lot. And so a normal flu season, we're very cautious. The regular rhinovirus would put Madison, down for 2 weeks. So our life, we would end up quarantining for that 2-week, 3-week period, depending on how long she was home or in the hospital. So we were used to the quarantine life in short term. We would isolate ourselves. We would cancel family outings or holidays that we were hosting in our house if Madison was sick. We, had a lot of canceled trips, whether they were vacations or school trips. And so that was something that we were already used to before COVID. Just, where you protect your child and you living, in a world where, her life is a little different. So when COVID happened, we were like, okay, we can do this. We've got this. Next slide, please. But after COVID, AC, I like to call it, things, were different for us than I thought. We got way more anxiety than I expected. We became super hyper cautious on anywhere, we went. We withdrew Madison earlier than, our school closed down. we were just, you know, the thought of one germ entering our house became a little overwhelming for us. So we went through a really tough time, and we were trying to figure out how to manage that. And for our family, we live in a very high populated area in South Florida, and we live in a dense, high COVID, instance. So, the anxiety was there for a reason. So luckily, we have a family home on the west coast of Florida where there's very low population, and we made the decision to cancel all of our nursing. And my husband was furloughed, so we said, okay, we've got more time, time for help and care, and we're going to move our family to the west coast because we needed to make that change. We needed to figure out what solution in our life that could help us with our anxiety. Just every Amazon package, every Instacart, we were wiping down, and we just were so nervous, and the time it took to worry about every little germ was taking over. So that helped our anxiety, and that was, for our personal family. But it definitely, it took a toll, because that means no more nursing, no more help. But it took a toll on Madison as well, because those were the last level of the in-person relationships. She loved her nurses, and she had, she would do TikToks with them, and she just had those special relationships that, she's missing. But in Madison's life, all of her in-person relationships, I didn't realize how much value they held, between her coaches. This is even, besides the kids, it's her friends. So I really had to get creative and focus on how to replace that, because she wasn't automatically using FaceTime that often, because everyone was in person. And then when she wasn't in person in school, in person in her after school activities, then therapists, then it was homework time and family time. So she didn't really utilize virtual technology at all. So we really focused. I had to really reevaluate, how can I make this change? So I reached out to our SMA clinic, and I said, do you have a psychologist that Madison can utilize on, virtual telemedicine? So we got that in place. Madison, we always offered it to her before, but she didn't need it before, and she was very open to it. So she does a 1-hour telehealth appointment every week, and then daily she does video journals, and it's really helping her. And I was very surprised at how open and receptive she would be to it, because mom suggested it, and God forbid. So but she felt that she really needed that. And then because I saw like the value in her tutors, I really kept up. I changed all her tutors to virtual, or her one tutor, her math tutor. And that really helps, because they chat beforehand. And then I had to reach out to the school and ask for OT to continue virtually, because unless the parents reached out and asked, they didn't reach out to us. So I asked for it, and I put that in place, because one, I wanted her therapies to continue, but I also, I was very cognizant on Madison's relationships with all the people that she was used to having in her life, and I wanted to add that in and keep that there as much as possible. I also, I encouraged her. I said, pick a new friend every day to do FaceTime with. I know you're not used to it, but they'll answer. Your friends are all FaceTiming now, but you have to sometimes be the initiator. And I just get the eye roll, of course, because I'm mom of a teenager, and whatever I suggest is like, oh. But finally, she's getting the hang of reaching out to her friends more often. So, It's helping. The other thing that we got creative in downloading apps. I let Madison pick out an exercise app. She consulted with some of her softball friends and seeing what, and her coach, and she downloaded an app that her and I can do together every day, a workout session. So it keeps her upper body strength and all the things that she's used to doing, either in PE or on the softball field. I wanted her to continue her activity level in what she was used to. And then we added another layer. So we're always working on arms, Madison, wants to keep up her arm strength, and mom definitely needs to keep up her arm strength. So we do these workouts together. It's something like 7-minute, quick arms or something. And I really focus on taking emotional breaks, along with the physical activity. But luckily where we are now, we get to go outside for a bike ride and feel very at peace. And she's now pushing me, so we have to do our 3 miles a day bike ride, mom. But she thinks she's pushing me to exercise more, but it's really such a beautiful, peaceful bike ride that I know what it also does for her. So it's my little trick. And it's working. And I have to force, not force, but really, encourage my husband and I to take, a date night, even if it's, whether it's a boat ride or just, we're driving to a parking lot, so we have an uninterrupted time together. And it also, us leaving the house without exposing ourselves, we'll do picnics in the car, and just so that way there's a certain amount of time we're gone. It gives my kids an opportunity, because they're older, time in the house without parents. It gives Madison, time to do her TikToks without, daddy making fun of her, or, her doing FaceTime where she's not used to having these conversations where people can overhear her. And it gives her some time where she feels that she's, when we're normally not home, and she still has that peace, that, like we love to be home alone sometimes and have that peace in our own house, and the kids like it too. So it's us getting a date night, but also, the kids having time home alone where, they're rid of us and they're safe in their environment. And then we just, we keep up with all of our telehealth, even if I don't feel like we need it. It was interesting. We actually did a telehealth yesterday with the pulmonologist, and Madison asked, she said, so, doctor, when school starts again in August, what does that mean for me? And what is that, if there's no vaccine? Because she's a smart cookie, so she knows, vaccines aren't coming anytime soon, and she sees that, and she's, wondering, what does this really mean? Even though our county is talking about everyone going back to normal, she says, what does that mean for me? So I know it's worrying for her, but it's good for her to hear it from the doctor. And it was just a well visit, but I wanted her to have that opportunity to ask the doctor. And, the doctor just said, we have to just be like we were before, but more cautious, and every decision is going to, depend on our family. And when the time comes, what everything looks like in August. But right now, she really wants us to stay quarantined for us and for Madison, and we just have to up our levels of exposure and who comes in our house. We definitely take time to connect with family, but I also had Madison start writing letters, and she's enjoying it. She's doing, some of the artwork, and rather than, sometimes we throw artwork away, we're saving every artwork and we're mailing it to our loved ones, and they're really appreciating it. So that's something that she feels good about, that she's making grandma, great grandma happy. When she calls and says, I just got your letter. So she feels good. It's not something she'd ever done before because we didn't have the time. And so that's been something that she looks forward to, she gets feedback on, and she's enjoying. We, back to pushing for OT, when I requested it from the school, it was an adjustment for Madison, but, the OT got creative and found things around our home. Madison yells out, Mom, I need a handful of coins, go find some. So and she, just her picking up coins and putting coins, keeping up her fine motor skills. I see her doing that a lot. She rolls socks. She's like, I need a long sock, and she rolls the sock. So the therapist is coming up with creative ways. We definitely know that she's not getting the same therapy, but we try and get her in water as much as possible, and I stretch her as much as possible. And we trying to think about all the ways, even outside of therapies, where she would regularly, like softball, what was her daily activity, and we try and replicate that, so that way she preserves, her body and her strength, and exercise, and trying to keep things as close to normal for our family as possible. Because, our new normal, we don't know how long, what it's going to be like moving forward. So when Madison returns, when the school returns, we'll just have to make this decision, for our family and for Madison's, her level of anxiety or comfort level as well. We found joy. Our whole family will talk about a house project, and we'll try and include everyone in it. We do a lot of, like I said, home improvements. We upped our level of pranking each other, so it's non-stop pranking around our house. We enjoy movie nights. We work out, like I said, as a family, and we take lots of bike rides and fishing trips. So we're trying our best to create a new normal during these stressful times, but we're just supporting each other, and I'm just always checking in and trying to think of creative ways. So thank you, everyone, for letting me, share our experience and our challenges and our new normal, and share my story with everyone. So I hope it was valuable. There's Madison on her adaptive fishing chair that my husband made, and she just feels free, and that's her passion. That's her stress reliever right there, just sitting in that chair. So thank you, everyone, and thank you, Cure SMA and AveXis, for giving me this time to share.
Thank you so much, Jennifer, and thank you to our wonderful speakers for their time today and their great presentations. We also want to send a thank you to our sponsors, AveXis, Biogen, and Genentech, for their incredible support. Another thank you to everyone who has participated and listened in on today's webinar. Just to note, you'll be receiving a follow-up email with a survey link, and we would greatly appreciate your feedback. If there's anything that we can do for you, or if you have any additional questions, please email us at familysupport@curesma.org. And we also wanted to announce that there are going to be 2 more Summit webinars this month. Look out for an upcoming latest news post, which will have the links for all that registration information.